Thank you and welcome to this very important press conference. I'm Greg Taylor. I'm the Chief Operating Officer of High Point Regional Health System. First, I'd like to introduce everyone up here on our speakers panel. And I'm going to start at my far right, which would be your left. And first, we have Ken Smith. Ken is the managing partner of Smith Leonard Accounting Firm and Vice Chairman of the Board of Trustees of High Point Regional Health System. Next to Ken is Mike Lucas. Mike is a practicing orthopedic surgeon with High Point Orthopedics, which is part of Cornerstone Health Care, and Dr. Lucas is our Chief of Staff. Next to Dr. Lucas is Dr. Tony Lindsay. Dr. Lindsay is the Chief Medical Officer of UNC Hospitals. Next, we have David Strong. David is President of Rex Health Care and the Chief Operating Officer of System Affiliations for UNC Health System. Continuing on my left is Jeff Miller, President of High Point Regional Health System. Next to Jeff is Gary Park, who is the President of UNC Hospitals. And then finally is Owen Birchie. Owen is President of Crescent Ford and Chairman of the Board of Trustees of High Point Regional Health System. So I am going to turn the floor over to Owen. Owen will be followed by Jeff Miller, and then Dr. Lucas will speak also on behalf of High Point Regional. Then we will hear from Gary Park on behalf of UNC Hospitals, and at that point we will open the floor for questions. Thank you.
Good morning. An exciting day here in High Point for the hospital and for our community. High Point Regional has a 108-year legacy of providing exceptional health care to our community. Our Board of Trustees commissioned a study of our long-term strategy last year. And during that analysis of our long-term strategy, we made a decision, the 21 members of the board, to pursue finding a strategic capital partner. And through an analysis of several good opportunities, we have come to a unanimous decision to partner with UNC Health Care. We look forward to continued strength here in our community, and we know that we will that we will be stronger with the resources and expertise provided by UNC Health Care. Thank you.
Thank you, Owen, and I share in the enthusiasm and excitement about today. And I do want to give you just a little bit of detail because I know there are lots of questions, and certainly if we don't cover the most important points, we'll be more than happy to answer questions at the question and answer period. When we began this process, I think that we recognized that there were any number of potential partners who could bring a lot of things to the table. What we were looking for was an attitude and a culture and an organization that we felt fit nicely into High Point Regional and our legacy and what we have been and what we want to be. And I really and truly think that all the other wonderful things about UNC set aside, that the thing that really made us feel very good and very excited and very unanimous in the decision was that these are our kind of people and they understand what we want to do here in High Point. And so we have negotiated with them. We have come up with a tentative agreement That agreement will now go into due diligence, which the attorneys in the room can explain to you. That'll take about 90 days. And during that time, we'll make sure we understand each other and go through that process. We would hope that by the first of 2013 that we would be able to sign a definitive agreement and let this merger occur. It is a merger. We are not selling High Point Regional to UNC. We are, in fact, merging our system into their system. We will be one. They will be us. We will be they when this is completed. We will be a wholly owned subsidiary. They will be our sole member is the legal term, I believe. And with that, we will be able to take advantage of the huge resources that are available to us through UNC. There are dollars involved, so let me explain how that works. One of the reasons that we began looking for a strategic capital partner was that we were having difficulty in this very competitive market with the challenges we saw being able to generate adequate funds to keep High Point Regional current and state-of-the-art. And so in this process, each of the potential partners, we asked for them to commit funds to us to help us through these construction projects. UNC has committed $150 million over a 5-year period to support us in our capital needs and to help High Point Regional stay current with what we're about, which is providing exceptional quality health care. In addition, they have agreed that we will together fund a new community fund. Community health fund is what we're tentatively calling it. We haven't settled on an official name. That will be a $50 million fund for High Point. And the dollars will be limited to health care needs in the community, focus on giving funds for indigent services, for all of those needy programs relating to health care that you and I are so fond of and aware of in High Point. And that fund will be separate and apart from this new merged entity. It will have its own local board. We'll have parameters that it will work within, but its goal will be to be another source of exceptional opportunities to take care of the people in our community, particularly those in need. So we are thrilled with the financial component of this agreement, but more importantly, we're thrilled with what it brings to us in terms of bench strength, in terms of physician expertise, in terms of so many things that we have recognized over the past several years that an independent hospital simply cannot stay strong with the world we're living in today. So we look for a partner. We had a very specific list of things that we were looking for, and when we finished these discussions, we said we have been blessed to have this relationship come to us and to occur. We approached UNC. We asked them if they would respond to a request for proposal, and we are confident that as this moves forward that in years to come we'll look back and say this was a very special day for the patients of High Point in our region. The people who were really involved in this and made this decision were our Board of Trustees, and I know several are here. I'm not going to try to introduce you, but if you are a member of the board, would you please stand so we can recognize you? One thing that people have said about what about our foundation, High Point Regional's foundation, the foundation will stay as is. It's part of the health system. It will continue to be part of the health system. It will continue to pursue charitable opportunities in this community and philanthropic giving, and will not be associated with the new Community Health Fund, which will be separate and independent, as I said earlier. The employees will remain employees of High Point Regional. There will be no workforce reductions. There will be no change in pay. Basically, operating as a subsidiary of UNC, we will be able to continue what we're doing and, more importantly, expand our workforce and bring new programs and new services to this community, which we're very excited about. The Board of Trustees, as a result of this, there will be some reserve powers that UNC will hold. They will approve any new members of our Board of Trustees so that they ultimately will have control of the Board of Trustees, but we have looked at the model that's in place, has been in place now for 10 or 12 years at Rex Hospital, and there has never been a time when Rex recommended a certain person for their Board of Trustees that UNC has said no. But as the sole member, they do have that authority. They'll approve our budget. They'll approve our capital expenditures. There will be lots of interaction between the two entities as we move forward. But the philosophy that we have heard and heard again from our friends at UNC is they believe in local control and local input, and that's what we're all about. So we're thrilled with that. Regional physicians, which is one of our subsidiaries, will be brought into this process as well as the hospital and all the other components of High Point Regional, and so we are thrilled with that. But the final thought I want to share with you is that we are going to keep and expand our services. We're going to protect our workforce, and we are going to maintain local control of High Point Regional, and I couldn't think of a happier resolution to a year's worth of work. So thank you all for being here, anxious to answer any questions you might have. And I'll turn it over to Dr. Lucas. Mike?
Good morning. I appreciate the chance to say a few words today. On behalf of the medical staff, I would like to say I could not be more pleased with this strategic partnership between University of North Carolina Health System and High Point Regional Health System. The UNC Health System mission to promote the health and well-being of all North Carolinians clearly encompasses our mission to provide exceptional health services to the people in our region. That alone makes this an excellent natural fit between our two organizations. Our medical staff is looking forward to working with the healthcare professionals at UNC Health System to help us deliver the highest quality, most cost-effective, patient-centered care we can provide. One of the benefits of this exciting new partnership is to improve the health of the people of High Point and our surrounding communities. By expanding access to the advanced health services and research available through UNC Health System. As well, I fully expect this partnership will continue to attract high-quality physicians and other healthcare providers and nurses that we need right here in High Point. This collaboration will also enhance our continued clinical services and help us develop additional services that we need to serve the patients of our region now and well into the future. The medical staff is looking forward to the opportunities this partnership will provide to High Point. Thank you.
I'm Gary Park, and I'm president of UNC Hospitals, and I have no prepared remarks because I want what I have to say today come from the heart, not from a written text. But what I'm going to say today, I speak on behalf of all of my UNC colleagues, but we're thrilled to be a part of High Point Regional. We have our board obviously voted unanimously on Monday. They're very thrilled to have this opportunity. I think we know what High Point brings to the table. We know that you're the top non-academic, by U.S. News and World Report, the top non-academic hospital in North Carolina. Ranked number 26 in diabetes and endocrinology, and the top performer in seven other specialties, and Thomson Reuters, top 50 cardiovascular centers. So we know all that, and that's extremely impressive. And I think that any system in North Carolina would be thrilled to have High Point a part of their system. And I'm actually humbled to be standing up here knowing that you've selected our system. And I want to assure you that we know that the talent that's here. A lot of people are going to expect something big to happen day one. I don't think there's anything big is going to happen day one. I think it's going to be an opportunity where we get to know each other, we work together. I think we clearly value local ownership. We value local leadership. Jeff mentioned Rex Health Care. I used to be president of Rex Health Care, and Rex has been a part of our system for 12 years, and there's never been a single thing that's been presented by the Rex board that's been turned down by the UNC board. Budgets all go through, all approved certificates of need. It's been a wonderful relationship, and we want that to have that same relationship with High Point. And I can assure you, our values. I think I've known Jeff for 20 years. Jeff has been a colleague. I think Jeff's had more experience in healthcare than I've had. So we expect to learn as much from High Point as you can expect to learn from UNC Healthcare System. So again, I thank you from the bottom of my heart for being selected. We won't let you down. I hope that you all look back 5 or 6 years from now and are very comfortable with the selection you made. So thank you very much for having us.